Almost 12 million people signed up for 2018 health policy under the Affordable Care Act, roughly the exact same number as last year despite having a shortened registration period and a determination by the Trump government to significantly decrease spending on outreach and advertisements.
A total of 11.8 million people selected a plan or were automatically re-enrolled for 2018 coverage through the ACA's federal and state exchanges, or marketplaces, according to a report Tuesday from the Centers for Medicare and Medicaid Services. About 12 million selected or were re-enrolled for 2017.
Many analysts had expected a lower sign-up figure because of the abbreviated enrollment window. Groups that support the ACA said the figures showed that Americans are embracing the health law despite Republican efforts to dismantle it. The American people don't want to go back to a time when insurers could deny them health care for having a pre-existing condition or be priced out of the market based on their age, gender or medical history, said Brad Woodhouse, campaign director for the advocacy group Protect Our Care.
About 8.7 million people signed up using the federal exchange in 39 states and 3 million more enrolled through state-based exchanges that typically had longer enrollment periods. Republicans said people are continuing to suffer under the ACA because of rising premiums and a waning selection of insurers.
We are pleased that consumer satisfaction was the highest it's ever been during the 2018 open enrollment period, said CMS Administrator Seema Verma. However, even with the success of this year's open enrollment, the individual market continues to see premiums rise and choices diminish.
The Trump administration reduced funding this year by about $116 million for outreach and advertising to inform people about the open enrollment period. The administration also cut the enrollment period to 45 days from 90, a proposal that originated with the Obama administration.
The open enrollment period for 2018 coverage extended from November 1 to December 15 of last year. The ACA exchanges allow people who don't get insurance through work or other government programs to get coverage and find out if they qualify for tax credits that help offset premium costs. ACA supporters worried that battles in Washington over repealing the health law, along with well-publicized Trump administration actions to weaken it, would depress sign-ups.
While about 12 million people signed up for health coverage in 2018, the number who will actually obtain and pay for coverage is expected to be smaller. For 2017, for example, about 12 million people selected health plans on the ACA exchanges, but only about 10 million of those paid for and obtained coverage.